And he had seen a lot of orthopedic surgeons and he's done a lot of things. Didn't work. Within 3 months, he coaches football. He's running up and down the sidelines again, and he hasn't done this in 10 years.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. Now, this episode is brought to you by Edna Digital Marketing, and I have with me here Dr. Abhinav Agarwal from Apollo Health. Now, Dr. Agarwal is an accomplished internist specializing in integrative medicine and aesthetics. He graduated from Wayne State University in 2009 and has held myriad clinical and administrative roles in his career to date. Now, his practice, Apollo Health, is in Gig Harbor, Washington, and focuses on the principles of excellence, engagement, ethics, empathy, and focusing on the human connection in medicine. So welcome, Doctor. Glad to have you here.
Thank you, Daniel. Glad to be here.
Yeah, so let's get right into it. Tell me, how did you end up getting interested in aesthetics?
The credit for that goes to my wife. She used to go and get Botox and occasional fillers. I never really thought too much about it, but one day she came back with a really bad bruised black eye. And
Wow.
that was pretty upsetting to me. She was seeing a nurse practitioner, I believe, at the time, and I thought to myself, well, I'm going to learn aesthetics myself, inject my wife, and really that's what got me started. But as I started that journey along the way, I realized that number one, I was enjoying the practice. Number two, I was really good at it, and so I decided to take that to the next level and actually introduce that into my practice.
Wow. So it was a labor of love in two ways, for your wife and also for the actual medicine.
Absolutely. And she actually loves it. She loves being my guinea pig now.
It's a great way of putting it.
Yeah.
Now, Doctor, can you explain or discuss some of the most popular treatments that your patients come to you for? And also, why do you think they're so popular?
Well, I would say the number one most popular treatment is straight up botulinum toxin, so Botox or Dysport. It's been around for a long time. People have proven results. It's safe, it's effective. They know exactly what they're getting into, and they like it. So that's the number one. I'd say fillers are pretty frequent. Hyaluronic acid fillers, thread lifts. We do thread lifts, and they're fairly popular. There's still some, it's a fairly more involved procedure. So patients have a lot more questions and a lot more counseling to be done because a lot of them don't understand it completely yet. Mm-hmm. And then, we do everything, including microneedling and, skin care and so on and so forth. Those are some of the most common ones. And in fact, in our practice, along with those, we are seeing a lot of focus on weight loss and body contouring.
Okay.
Yeah.
So those are the ones that you're starting to see become more and more popular then?
Yes, weight loss, body contouring, skin tightening, those are absolutely getting more and more popular.
Okay, got it. Now, Doctor, I know that your practice is a little bit different from most other aesthetic practices. You look at it much more from a holistic point of view. So looking at regenerative medicine, functional medicine, the aesthetic side. Could you talk a little bit more about that, like the approach you have and how that makes your practice different from a lot of the other ones?
Absolutely, Daniel. So aesthetics is basically not just simply correcting whatever problems we have, but we have to look at the root cause of the problems. And a lot of the times, those are mired in underlying endocrine hormone imbalances, endocrine deficiencies, vitamin disorders, suboptimally controlled diabetes, hypertension, et cetera, et cetera. So as an internist and with a huge focus on integrative medicine, I prefer to optimize everything that I can for my patients' inner and outer well-being. So when they come in for an aesthetic treatment, we always take that opportunity to talk to them about their health and how we can optimize that so that they can get better results, they can get longer lasting results, and they're more satisfied with the whole process.
Mm-hmm. Okay, so, and this is actually something that I'm starting to see a trend where aesthetic practices are looking a lot more at the holistic viewpoint because there's so much more you can do from that point of view. But I guess, would you say that the people that are interested in this is because they've tried traditional medicine and it just doesn't work for them?
So there's two components to this. I would say in the aesthetic world, people who are looking for a specific outcome aesthetically and they want a specific procedure, so we counsel them on which aesthetic procedure can get them that outcome, while raising their attention to their underlying health issues and how optimizing those might help them get an even better outcome. So my background as an internist and focus on integrative medicine helps me get that message across. On the medical side, when patients come to see me for simple things like hypertension, diabetes, or any rheumatological disorder or whatever have you, we take that opportunity to, of course, we're going to fix their underlying medical problems, and we use integrative medicine therapeutics, hormone optimization, peptides, etc. And we also point out to those patients how you doing these therapies can help them optimize their aesthetic selves.
Okay, so you're looking at fixing the root cause of their issues and tying that into the aesthetic side as well, is what it sounds like, right?
For every patient who comes in, they get a complete medical as well as aesthetic evaluation, and it's up to them to decide how much they want to do.
Mm-hmm. Okay, got it. Now, since it sounds like there's a lot that goes into this, so you must have an amazing team who's there to back you. We mind talking a little bit more about your team?
Absolutely. My team is brilliant. I mean, these guys, I'm only as good as my team makes me. So we have 2 front desk girls, we have 2 medical assistants, a nurse, and the office manager. And they are instrumental in they optimize the patient care experience so much. So they get the patients in, they always get them comfortable. They prep the patient accordingly, depending on whatever they're looking for. They get that feedback to me. I go in and do my thing with them. And then, as you know, patients always have questions and concerns, right? As soon as the doctor leaves, that's when they said, oops, I forgot that one.
Yeah.
So they are very, very good at getting all that information, answering those questions, doing the follow-ups, and then getting the information back to me. So we have a very, very good system. And my team is absolutely brilliant, and they're only getting better and better.
Okay, that's great to hear. Now, I'm sure this is going to tie a lot into my next question as well, but what is your approach on how you're able to educate your patients on the service you offer and also the benefits of it? I'm sure there's a lot of questions where they're not quite sure, especially when you bring the holistic side and they may not understand that. So how do you approach that educational portion for your patients who are maybe not quite sure of how this all works?
That's a great question, Daniel. It's very complicated to be discussing so many issues. I always make sure that all our initial patient consultations are at least 60 minutes. And if we have to take any longer, then it is what it is. We take the time to do a deep dive. Most of medicine that we deliver and any aesthetic services, it's based on patients' beliefs and what they would prefer. So some people have straight up preference for the traditional Western medicine, and we give them all the best solutions that they have over there. But I also highlight to them the pitfalls of any such choices and how choosing safer options in regenerative medicine therapies might be better for them long term. For example, diabetes, if it's so common, most traditional approaches will say, hey, you're diabetic, your hemoglobin A1C is 7, we're going to start you on metformin, you got to watch your diet. I don't necessarily have to go there. I always start them with number 1, optimizing their underlying hormone imbalances, because that helps optimize their metabolism. They're going to lose weight and lose the diabetes. I can get the blood sugars down with a combination of things like magnesium, chromium, alpha lipoic acid, vanadium. And patients like this because these are things that actually work and they can get the same results without having to take a pharmaceutical agent. And this is just a very simple explanation, but we take the time to do this. I look at the patients and exactly what they're looking for, what kind of approach, and we custom we tailor each approach to each patient.
Okay. Now it sounds like it's almost probably sounds like magic to some of your patients that have gone through this entire process where it's like, okay, they've tried this, they've tried that, but then they go to you fix the root cause of it and it works. So do you have any stories of those, like people that come to you and it's like, wow, this is incredible, I can't believe it, it's just like, it's like magic?
Daniel, that's I have so many stories, but let me tell you, I train in traditional internal medicine. That's my residency. My entire life, I was a hospitalist up until recently, and when I started my own practice, and I got into integrative medicine, and I realized I had to unlearn some bad habits and learn some new good habits. Applying them over the last couple of years to our patients. So one of my patients, she was 65, 66 years old, struggling with energy problems, mood problems, weight issues, low libido, came to see me. We fixed her hormone imbalance, we fixed her nutrients, we fixed her gut health. She lost 25 pounds within 3 months. I didn't give her any intervention for weight loss. I just fixed her underlying imbalances. 25 pounds in less than 3 months. She's one of my poster child. She's going around the town telling people, you gotta go see him, you gotta go see him. I had another gentleman. He's a very active guy, been a hiker, been a soccer player, been a football player when he was younger. He had a bunch of injuries. He used to love running. He hasn't been able to run in 10 plus years. Came to see me. I did the same basic approach, but I added some peptides to his knee injury area. And he had seen a lot of orthopedic surgeons and he's done a lot of things. Didn't work. Within 3 months, he coaches football. He's running up and down the sidelines again, and he hasn't done this in 10 years.
Yeah.
So for me, every complicated patient is a challenge. We love taking on challenging patients and helping them.
Wow, that's an incredible story, and it sounds like, especially that woman, she's your best marketing is that she's going around telling everybody what you've done for her.
Absolutely, there's no one better than my work out in the community that people can see and relate to.
Oh yeah, absolutely. I'm sure this is just two of many stories that you have. I'm sure you have tons of other patients with this exact same thing. They have this issue. They've tried all these things. What if it's weight loss? They've tried dieting. They tried exercise. They tried this fad and that fad. Never worked. And then they come in to someone like yourself, who has a more holistic view of it, and they're able to solve it very quickly. I mean, it's incredible.
It is absolutely amazing. Like I told you, I learned a lot of new approaches in the last few years, which I've been applying to my patients. And, even in terms of options available to me as an internist, where I had 2 or 3 options, now I have 20 to 30, and I can use them in rotation and get incredible results.
Okay, now that actually leads me to another question for you. What out of all these new and emerging treatments that you're seeing, what are maybe 1 or 2 that you're particularly excited about?
Peptide therapeutics is absolutely amazing. I would say, so peptides are short chain amino acids that are signaling molecules inside our blood. And over the last few years, we've been able to extract them and, get them packaged in vials or creams or pills or whatever have you. I'm using them for things like athletic injuries, and recovery time is shortened from, let's say, 9 months down to 3, with or without surgery. And a lot of people are going without surgery when we're applying these. For GI issues, which gut health is so suboptimal in so many people, we're using peptides there. We're using peptides for dementia. We're using them for skin health and aesthetics. You name it, there's something out there, and it is a rapidly evolving. This is the next frontier in medicine.
So it's like the science fiction is now coming to real life.
For our benefit. I mean, it's absolutely incredible, and in how effective these molecules are.
Okay, that's good to know. So aside from the peptides, there's something else that you're also seeing out there that you're really excited about where the future of it can go?
Aesthetics, I'm definitely super excited about aesthetics. In terms of the aesthetic side, the number of treatments and the type of treatments that we are able to offer our patients is growing exponentially. The industry is growing, and so is the R&D and the products that we're able to offer. So anywhere from the threadless procedures to different lasers to energy-based devices and so on and so. And a lot of them we are getting amazing results with non-invasive devices. Gone are the days where people said, it's surgery or nothing.
Yeah.
We've got a non-surgical solution for you out there. And so that's super exciting. In fact, later this year, we're going to probably grab a couple of devices and also launch hair restoration in our practice.
Oh, wow. Okay. Yeah, I know that a lot of people in their mind, when they're thinking aesthetics, a lot of them think of surgical, but I'm sure you have a lot of patients that are kind of scared of that surgical path, and they want to see, okay, what's the non-surgical path, but can still get me the good results, right?
Absolutely. A lot of it comes down to correct patient assessment. Some patients, they do need surgery if they're going to get a realistic when you need surgery, you need surgery. So it's our job to guide them appropriately and get them their best value for money too, because aesthetic treatments are pricey, or they can get pricey depending on what we're looking for. So guiding patients to the right outcome is the most important thing.
Okay, got it. Now, you mentioned before there's quite a bit of service that you provide to your patients, really trying to figure out what is going to be the best fit for them. So how do you balance providing that relaxing experience for your patients that come into the office, is maybe going to get a treatment or procedure they may not fully understand, but also balancing that with ensuring their safety and well-being during the treatment?
So preparation is the most important thing, and choosing our patients, counseling them properly, setting realistic expectations about what the procedure is going to look like or what that process will look like, ensuring good pre-care, care during the procedure. We take our patients, we give them enough pain and anxiety medication in whatever form to make sure that the procedure is as painless as it can be. Because if the patients have a painful procedure, you're pretty sure that they're probably not coming back for something like that. And then ensuring really, really good aftercare and follow-up. So this is where my team, like I told you, is absolutely incredible, and they connect with the patient before, during, and after, and of course, our patients love it.
Right. Now, Dr. Agarwal, where do you think the future of aesthetics is going?
The future of aesthetics is bright, and especially I would say the future of non-invasive aesthetics is even brighter. We are, non-surgical aesthetics. With the amount of R&D and products that are coming out and the excellent results that we're getting, patients are going to be getting better and better results, which are safer and more cost effective for them as for the next few years. We're very, very excited. For aesthetics.
Okay, now you mentioned this before as well, but I want to dive a little bit deeper into this. It's mixing in the holistic viewpoint, the regenerative medicine, the integrative medicine, and the aesthetics part of it. Do you think that that's going to almost become a staple in aesthetic practices in the future?
So we would like it to be so. However, unfortunately, Daniel, you can get aesthetic services at a lot of centers where physicians are not around or qualified providers are not around to actually monitor those kind of results and deliver this kind of results. So, and even for physicians, when physicians are leading the charge, so to speak, they have the knowledge, skills, experience to combine both those, all those modalities. In the non-physician world, patients are probably not going to get that full experience. There are a lot of rapidly expanding changes and a lot of science and research that comes out. So having qualified providers to look at that and reevaluate our own practices and keep refining our products and services for our patients is important. So to answer your question, I don't think most centers, the way they're run, will adapt accordingly, but we hope more and more people will adopt this approach.
Well, it really comes down to the end care for the patient, is that if they're getting the best results, they go to the provider who could provide that to them. Now, there's actually another question that came up that I was thinking as you were answering that, is that there's a lot of aesthetic practices that are not run by the doctor. It's maybe like a nurse practitioner or someone like that who's doing the procedures. For patients who are thinking about, okay, do I go to this person who's an actual doctor versus someone else who's maybe a nurse practitioner? What are your thoughts on the difference between each of these two?
Daniel, I would say I know a lot of nurse practitioners who are absolutely incredible injectors, and I know a lot of physicians who are not so great injectors. So it depends on the procedure that the patients are looking for. I would say it's if you're looking to get a procedure that's pretty garden variety, maybe like Botox or a Dysport or a filler, going to someone who does it more frequently might be more helpful. Not necessarily with the most number of degrees behind their name. But when it comes to more complicated things, I think someone who has more knowledge, skills, experience, and the ability to deal with complications should they arise is important. So I know in the aesthetics world, people are always, it's a very price sensitive world. I always advise patients, you will get what you pay for. And if you're going to go to the cheapest injector on the block, there's a reason that they're the cheapest. So you may not like the outcome. At the end of the day, when we get our patients in, it's always about trust and establishing clear, number one, the right person for the right procedure, and ensuring that there's trust and a good follow-up. And usually when patients see that come through, they will usually follow the recommendations.
Okay. Now that's great to hear. Now I have one last question for you, but before I ask it, I want to point people to your website, which is apollohealthdoc.com. Now the last question is, what do you think is the most important piece of advice you can give to someone who's maybe on the fence about getting treatment or procedure done, but there's something holding them back?
I would say come in for a free consult. The consults are free. Talk to a person who can actually explain the process to you, what it looks like, get a feel of the land, so to speak, see the staff, ensure what kind of a relationship you're going to have with these people. Do not, I won't say do not, definitely you can get some information off the internet, but you have to remember that the internet is filled with all kinds of information, good and bad. So filtering it down and taking someone's knowledge, skills, and experience and getting that presented to you is the right thing to do. So come in to a qualified professional. If you're on the fence, most consults are free. Come in, it'll be worth your time and energy, and whether you want the procedure or not, that's, you can decide after the consult.
Okay, perfect. Well, there you have it. Dr. Agarwal sharing his experience with all of you. Now, Dr. Agarwal, where can people contact you and your practice?
So we are available by phone, text, email, all of it. Our website is apollohealthdoc.com. Phone number is 253-900-2185. And they can text us on through our website as well.
Okay, perfect. Well, great. Thanks again for being on the show and sharing your message with everyone.
You are welcome. Thank you, Daniel. Have a good day.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.